Good afternoon. Thank you for coming in this afternoon. Looks like we have you scheduled for a preliminary brace fitting as well as preparation for jaw positional surgery, quite possibly. So you've spoken to the orthodontist and gone over some of your options. Okay. Well, believe it or not, it's not nearly as scary as it sounds on the surface. But repositioning the jaw forward is actually a very common and a very high success rate type of surgery. So if you're an analytical type of person, the numbers are very much in your favor. And if you just want some emotional comfort, just know that the vast majority of people that undergo this procedure definitely have a positive outlook on it. Okay. So to start off, what I'm going to do is just a preliminary fitting for braces prior to the repositioning. And I'm going to make a mold of your teeth in the current state that they're in, as well as get some general notes of anything that might be a preliminary concern before you go into the surgery. Give you a breakdown of some of those steps, give you a little bit of preparation time if you have any kind of questions along the way, and hopefully put your mind at ease regarding the procedure. Alright, so to start off, do you have any concerns? Are you feeling well today? Are you feeling any anxiety over this? Yeah, anytime that you go into surgery or surgery is considered, I know that it's always a little nerve-wracking. I assure you this is not something that anyone takes lightly, but it's also something that has a very good success rate, so are you feeling okay today? A little anxious? It's understandable. Okay. With your permission, I'd like to just examine the inside of your mouth to see whether or not there's anything that needs to be addressed beforehand, any kind of infections, toothaches, if there's any cavities that might be in the works, anything that needs to be addressed beforehand. Okay. I'm going to sanitize my hands, and then I'm going to put my gloves on. For documentation purposes, are you a frequent gum chewer or do you smoke? Okay. And when was the last time you brushed and flossed? Okay. Have you ever experienced anything, we call it lockjaw, but TMJ, where your jaw gets stuck into a certain position? Have you ever experienced that? Have you ever been treated for it? Okay. Not professionally. Okay. Have you ever had any adverse effects to something like Novocaine or lidocaine? Well, we're going to start with the basics. Do you mind if you just open up for me here and I can shine a light in your mouth? Okay, thank you. I'm going to just pull down on your lip a little bit. Okay. To your cheek. Okay, I'm going to pull up on your top lip here. Your gums are nice and pink. I'm going to feel around your jaw and your neck area here. I want you to try to relax your teeth, your jaw. Try not to clench if you can, okay? I'm going to place my hands on the sides of your face here, and I want you to rotate your jaw to the left and the right, if you don't mind. Okay. I'm going to try pushing back just a little bit on this side, okay? Okay, go ahead and resist me. Alright, now the other side. Okay, now go ahead and clench your teeth. Not too tight though. Alright, just allow that to become more relaxed. Gotta go down your neck and feel your glands. Have you had any recent infections, anything like that we should know about? Gonna palpate the area. Does any of this hurt? Or is it uncomfortable? Okay. And from your cheek, I'm going to press and feel all your teeth. I'm going to do some just palpations of your nasal cavities along with the cheeks and nose area here, and that way if you have any kind of tender pressure buildup that's going on, clearly if we don't, or if we're beginning to have like a sinus infection, you don't want to jump into this just because it's going to limit your ability to breathe out your mouth. You'll be able to breathe out of your mouth, but just in case you have any upper respiratory type of infections, we want to make sure that we can start treating that and getting that under control. So, just going to press on your nose here a little bit. Your forehead. Does any of this add any uncomfortable pressure or anything like that to your face? It actually feels good. I understand. On your jawline here, you have a bunch of lymph nodes that go under your jaw and down your neck. Just move your windpipe side to side a little bit here. Okay, that's a little bit uncomfortable. Yep, that's normal. Alrighty. This next part is not always the most pleasant, but what I'm going to do is I'm going to take a mirror and I am going to very delicately scrape the surface of all of your teeth before painting on a lubricant and then applying a epoxy-based molding. That will take several minutes to set, and then we'll have a perfect model of what the inside of your mouth currently looks like, okay? Okay. Are you going to be comfortable for the next couple of moments? You can take a time out and take a breather if you need to. Okay. Let's go ahead and get started. I'll be very gentle. Although unpleasant, this should in no way be a painful procedure, okay? Go ahead and open up for me. Good. And I'm going to start with your right side on the bottom. Okay, move to the outside of the tooth. Your teeth are very clean. That's always a good thing. Just go ahead and try to relax your jaw a little bit over on this side, okay? Try to relax. To the front here. Pull your lip down. Almost down on the bottom. Okay. And now a little bit on the inside there, okay. Good job. There's a cup of water to your side there if you want to just switch it around a little bit, or if you're feeling comfortable, it's more than okay. Alright. We can move on to the top row. Let's start again on your right, and we'll start on the inside and move our way out, okay? Okay. And just try to relax. There we go. gonna use my mirror very quickly here to check the back of your front teeth here. Can you open up? Okay. The front row is not going to be as pivotal as the bottom because it's not the front that's actually moving. Just gonna scratch along the back so that we can get a good print. You ready? Go ahead and run your tongue all around your teeth and they feel nice and smooth. Okay. Yep, that's what we want. One more time for a look-see in the mouth. Go ahead and open up and try to keep your tongue on the bottom. Just press your tongue, move it around a little bit. You have no other abscesses or anything like that? Okay. No, everything looks nice and healthy. Okay. Alright. Not that my opinion matters, but we're going to go to the next step. And the orthodontist will be able to make a final decision about what the next move is, okay? But right now we're going to make a preliminary mold of your jaw and your teeth in its current position. Also flex your jaw muscles here, see if we can't loosen those up, and also I can give you some instructions for exercises. Okay. So the first bit is going to be the actual mold, and it comes in this epoxy putty. It's a green color, so it looks really interesting, but it will cause discoloration on your bite. So if something is misaligned, you'll see the color will be much more evident on the bite stick. Warm that up a little bit. Okay, so while that is combining, I'm going to take a little bit of a lubricant and coat your teeth with them so that it will come off much more easily, okay? Okay. Thank you. Just try not to swallow too much, okay? your mouth open a little bit for me if you don't mind. Alright, now the epoxy is a 2-part epoxy, so it's going to feel very warm when I place this on your teeth. Not hot. It's not going to cause any kind of heat sensitivity with your teeth, okay? So let this gummy lay it along on the top of your teeth here and smush it over the tops. Now, do you mind biting down for me? You don't have to do it, just very normal if you can, okay? Alright, keep them there. I'm going to roll the epoxy down the front here. It's nice and warm. Okay, go ahead and open. Okay. And I'm just going to form this to the insides. Okay, very good. Keep your teeth slightly separated. Okay, I'm going to fold this one down here. Take a deep breath and open wide. Okay. Okay. I'm going to put a wooden stick between your 2 teeth. Okay, so go ahead and just rest there while I fit that to the outside of your teeth. There we go. Go ahead and open up a little bit more. Just move this around to the back. Doing a great job. Good job. Okay. Alrighty. Again, I'm going to put that stick just between the top. So, lovely. I'll just keep the epoxy from bonding to itself. Although if it does, it's not a big deal, okay? See, that's not so bad. Yeah, this is the hard part. So look on the bright side. Once you get past this, the rest of it's going to be a breeze. It's a very standardized procedure. It's very, very common. So what I'm going to do while this is taking 5 or 6 minutes to cure, to get to be hard enough where we can take it back out, I'm going to do a little bit of massage and focus on your jaw joint muscle right here. Now with your jaw relaxed, this portion right here, you can feel my fingertips on that tight muscle. This is going to be one of the areas that you'll focus on in therapy, because your bite may change. And if you've ever experienced TMJ, you know that sometimes this area can get very stuck. So you just want to massage this part right here where the two meet. And an exercise that you can do often when that gets to be very, very restricted is to move your jaw forward and then recess it and then back out. And after the surgery, they're going to have these 2 parts of the bone that are going to slide, but you'll have some brace here and then on here. So it's going to keep it in position. You're not going to hurt anything. And then you'll have some bands that go between your top and bottom teeth. And that will just make sure that the motion is very straightened back. Like this. Right. Because we want to make it as fluent but as symmetrical as possible too. around just along the front edge here. Make sure that we have everything nice and pushed in together. So I'm going to pull your lip out. Okay, make sure it's nice and tight. Up against the teeth. Okay. Alright. I think we're actually ready to remove it from your mouth. This does adhere. It does cure very quickly. And as long as it's not going to misshapen the mold by removing it, there's no reason to leave it on for an extensive amount of time. Okay. Alrighty. I'm going to grab the stick. Go ahead and just let up for me. Okay, good. And now we're going to start with the bottom. I'm just going to lift it very gently with my fingertips. Beautiful. Okay. Comes the top one. Just pull it down a little bit. Good job. Alrighty, so we have a top and bottom mold. And I will set those aside. I'm going to shine a light in the back of your mouth here. I just want to make sure that we have all of it. That you don't have any pieces of epoxy stuck in your throat, okay? Stuck in your mouth. Yep. Nice and clean. Very nice. Yep, it's all nice and clean. See? That's all that was. Easy peasy. Believe it or not, the next phase will also be just as easy, if not more so. You're in fantastic hands. Not only are you in some of the best hands, but it's a very, very common, very high success rate procedure, so you'll get through it. It'll be okay. In the end, it'll be totally worth it. There's refreshments to drink in case you feel like you want to rinse your mouth out. You're also welcome to brush your teeth at the station, and if you need anything else before you go, just let us know, okay? Alright, my dear. It's been fantastic seeing you. We'll see you again in a couple of days, couple of weeks, depending on the doctor's recommendation, and we'll just go from there. Alrighty. In the meantime, take care of yourself. I'll see you soon.